This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Well, I'm Dylan Lutter. I'm an equine surgeon at the Kansas State College of Veterinary Medicine Teaching Hospital, and I am interested in the effect of mesenchymal stem cells on equine tendon and ligament injury. I'm really excited about this sort of research and clinical application for the potential it brings in improving clinical outcomes with my patients and really being able to help horses ultimately get back into performance and remain sound. I have done this a fair amount. I've been experienced both clinically and in the research field. I did my master's degree looking at the effects of bone marrow-derived mesenchymal stem cells in deep digital flexor tendon injury in horses, and followed that injury out with the use of MRI actually to see how those tendons heal. And in addition to that, I've used stem cells in a number of clinical cases, and both for tendon and ligament injury and for osteoarthritis. You know, I think the success rate compares very favorably to some of the conventional treatments. I think it's really too early to tell truly how these things are going to affect, but I think right now there's a lot of potential, and that's definitely worth getting excited about and looking into things a lot further. You know, right now we focus on arthritis as the major impact in the equine performance industry, as well as tendon and ligament injury, but I think we can certainly, there are some clinical evaluations of the effect in laminitis. Fracture healing is starting to sort of come up now from the basic sciences. And so as we get more and more information on how stem cells behave and what the best sources for these are, I think just the number of diseases where it's applicable are really going to proliferate. The process I'm most familiar with, and currently the one I prefer, is you have a horse with a clinical injury and you make the diagnosis and then draw the bone marrow at that point, send it off for culture, and once the cells are ready for injection, then you either perform the ultrasound-guided injection, or if it is something that requires surgery to fix, then you inject the cells directly at surgery. So either one.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.